now to another CEO of Discovery Health, our guy, our dude, Dr. Ron Whelan.
I don't think Dr. Ron Whelan, I don't think you walk around the office with people going, my dude.
My dude.
No, hi there, Anele. Great to be with you this morning. I certainly don't walk around the office being called my dude. I'd love to be called my dude, though.
Well, this is the first time it's happening. What's up, my dude? Listen, Ron, listen, I had no idea about generics. Yesterday was the first time. Ask Frankie. I was probing them. I'm like, and then? And I
said to Anele, Ron, actually, I've received emails from Discovery because I'm a Discovery Health member.
Yeah.
And I've received emails asking about the generics and remember, these are cheaper options for you, especially if you've got a savings plan. Is that correct?
Yeah, exactly. I mean, firstly, I'm delighted to hear that you're a Discovery Health Medical Scheme member. And I think Dr. Bochumelo, who I do know very well, we've been friends for many years, I think has given you an excellent explanation of generics. And I think important to highlight that they have the same active ingredient and therefore have the same efficacy, the same quality, the same safety. And SAPRA does a brilliant job in registering medicines in South Africa, has an excellent scientific team. So we are completely reassured by the quality of generics in South Africa. I think secondly, as you rightly point out, and Dr. Botumelo pointed it out as well, is that generics are typically much more cost effective. So anywhere between 22% and 56% cheaper than the originator molecules. I mean, that's a significant price differential. And with that price differential, it allows you to achieve more affordable healthcare. It allows your savings plan to go much, much further. It also importantly, and Anele, I think important to point out, is that medical schemes run as not-for-profit mutuals. So all of the money in a medical scheme is members' money. And to the extent the medical scheme can save money, it means that the next year's contributions will be lower. So we look for opportunities to save costs while preserving quality of care, and generics is an excellent way to achieve that.
Dr. Ron, last question from my side. I know we want to ask you another one as well, but just quickly, do you guys, as Discovery Health, for example, do you petition some of these originator pharmaceuticals because drugs are expensive and not available, openly to a lot of members? Like I think a few people have stories about medical health schemes not being able to supply the latest drugs on the market because they're so expensive.
Absolutely. I mean, I think we do two things. The first thing is we work hard to establish a formulary across Discovery Health Medical Scheme that includes a range of cost-effective medication, including generics and innovative molecules. I think secondly, we have a collaborative, although a firm working relationship with the pharmaceutical companies to try and bring the cost of medications down in South Africa. We obviously in South Africa have many international pharmaceutical companies who face exchange rate pressures and other pressures, but we recognize that affordability is a prime concern in South Africa. So work closely with these pharmaceutical companies to get the best possible pricing for South African healthcare consumers.
Okay.
All right, and then quickly, whilst we have you here, because we might not get a chance to speak to our dude again, of a lot of people, when they heard that we're going to chat to you, they were like, please, can you just ask him about the National Health Bill? Where is it? Should we be concerned? What are the red flags that we should be looking out for? Am I keeping my medical aid? What is happening? What's Discovery's stance on that?
Very important question, and thank you for asking that, Anele. I'm glad you asked that. I think the first thing to say, Anele, is that South Africa has an excellent healthcare system, both across the public sector and the private sector. We have excellent doctors, nurses, healthcare facilities, and we must protect that. So any reform that happens in the sector must protect that. I think secondly, we do need to reform our healthcare sector in South Africa. So there is significant inequity across healthcare, as there is in many parts of the economy. So there's work to be done. It's important that your listeners understand that the NHI is a very long-term project. It will take many years to implement and potentially even decades to implement. So we don't see any immediate changes to the healthcare system. This is a very, very big project that includes healthcare financing and massive healthcare reform. Our stance as Discovery is we're fully committed to universal health coverage, but we don't believe the NHI Act in its current form is workable without significant private sector collaboration and funding.
Yes.
So we need to work together to develop a workable framework for NHI that includes the private sector funding and private sector collaboration. We're therefore working closely across many spheres in government and across several partners in the healthcare sector and the economy more broadly to put forward a proposal and a narrow set of proposed amendments to the NHI Act to make it workable and to enable this private sector collaboration.
Okay.
But important that you know that this is a long-term project. If you're in a fortunate position to afford medical scheme coverage, don't give up that medical scheme coverage. The NHI is not in place yet, and the funding is not in place yet. If you don't have medical scheme cover, you'll unfortunately then face significantly out-of-pocket payments and will likely have to access care through the public sector. So a long road still to travel, yeah.
Okay.
Thank you so much for that. Dr. Ron Whelan, our third favorite person at Discovery. Does he want to know who the other two are?
I don't think we should tell him.
That we don't, Immaculata and Dinesh.
We're not going to speak
We're not
about
going to tell him
Immaculata
that,
and Dinesh.
okay, that he's the CEO, but he's our third favorite person at Discovery.